A heartiest welcome to one and all. Today, we will be talking about liver cancer care, organized by ISW Council, powered by Roche. The topic for discussion for today is everything you need to know about liver cancer. So, as we all know, cancer is some sort of a taboo in this country because many people do not have the right knowledge. Today, we have a very eminent expert here with us, Dr. Pragya Shukla, who is the HOD of Clinical Oncology at Delhi State Cancer Institute, to share more about this topic. We welcome you to the show, ma'am. Thank you for joining.
Thank you. My pleasure.
Great. So, in this series, a talk show in which we are having conversation with Dr. Pragya Shukla, we will be telling you everything that you need to know about liver cancer. So, ma'am, let's start with the first question. What are the warning signs and symptoms of liver cancer that people should be knowing about?
So, liver cancer per se usually manifest with signs and symptoms at a very later stage. In the initial stages, mostly it doesn't have any symptom. So, there are two types of liver cancers. Basically, if you have to divide broadly, one is that originates at some other part of the body and then metastasizes to the human other to liver, and one is that originates de novo in the liver cells due to mutations. So the difference is that in a metastatic cancer, the signs and symptoms of the disease are already there because there's a primary site which has been affected by cancer. And in the other form, which are primarily disease of liver cancer, the signs and symptoms are not there of any other disease. So what happens is the signs and symptoms appear with malfunctioning of the liver. So what, do they manifest it is that there is pain, then there is swelling in the abdomen, then there's loss of appetite, loss of weight, which is not intentional. Then there is yellow discoloration of the skin, of the sclera, that is of the eyes, of the urine. The stool becomes clay colored. So these are the symptoms which show that the liver is being affected in some way.
Thank you so much for sharing that, ma'am. And for our viewers, please listen to all the signs that ma'am have shared. These associate with different parts of the body. So, as ma'am rightly said, liver cancer is something that is detected very later in the stage because many of the signs and symptoms can be confused with other diseases symptoms as well. So, if you have one or a few or more of these sort of symptoms that ma'am shared today, please make sure to visit your doctor and get checked properly. Let us now move on to the next question. Ma'am, what is the difference between primary and secondary liver cancer and what is hepatocellular carcinoma? Please share in easy language so that our viewers can understand.
So, as I told you previously, there are liver cancers can be divided broadly into two types. One is cancer of the liver cells per se, and the other, which we call metastatic disease to liver, in which the cancer primarily is affecting some other organ of the body, like breast, maybe lung, maybe sarcoma, and those cells from from the primary site metastasize to the liver. So they present as liver lesions. So now coming to the primary liver cancer. So liver cancer can be hepatocellular cancer, in which, like as the word suggests, hepatocellular, the hepatic cells, that is the liver cells, are being affected by cancer. And then there can be a cholangiocarcinoma, in which the bile ducts, which are in and around the liver, bile duct, the ducts which carry the secretion of the liver in and around the liver, get affected by cancer. So these are the two kinds of cancer of liver.
Thank you so much for sharing that, ma'am. So now we know what are the signs or symptoms of liver cancer. And we also know what does primary and secondary liver cancer and hepatocellular cancer means. Now let us move on to knowing how this can be caused. So there are different types in which liver cancer can be caused. Uh, so apart from viral infections, what are some of the other non-viral causes of liver cancer, ma'am? Please share.
See, if I come to metastatic liver cancer or liver lesions, like we call, so one of the categories is that in which the origin of cancer has been in some other part of the body, and from there the cells have come to liver. So one is this cause. Now, if I come to primary liver cancer, so one, as you are mentioning, viral infection. The viral infection is due to hepatitis.
Sorry, ma'am, you mute now. So can you please repeat your last line?
So viral infection, as you rightly said, are of two types. One is hepatitis B and the other is hepatitis C. So we see that in Western population, hepatitis C leads to major cause of liver cancer is hepatitis C, whereas in Indian population, the major cause is hepatitis B. So other than the viral infection, we have chronic liver infection or liver hepatitis, that we call chronic hepatitis, that causes liver cancer. Then we have alcoholic cirrhosis, which leads to liver cancer, wherein the cells of liver are disturbed, or they are harmed, damaged due to the intake of alcohol in large quantity. And per se, we are against alcohol in any quantity now, because every form of alcohol, every quantity of alcohol is deleterious to the health. So it is not that a small amount of alcohol protects us. No, it is not. All amount of alcohol, any amount of alcohol, any kind of alcohol is bad for health. So one is that causes. Now, one of the causes, liver fatty, the liver becoming fatty. So, and that too of higher grade. Grade 1 fatty liver is prevalent in many people. That is not the thing. But when the grades increase, they lead to cause of concern and may lead to cancer of the liver.
Thank you so much, ma'am. So as ma'am pointed out, there other than viral infections, there are few different types of non-viral causes as well. Chronic liver hepatitis, alcoholic cirrhosis, fatty liver disease. And ma'am also pointed out, which most of the doctors, all the doctors recommend, is any quantity of alcohol is bad for health. So please keep that in mind. Let us move on to clearing our other doubts, which leads to our next question. Ma'am, how does long-term infection with hepatitis B virus or hepatitis C virus in fact impacts the liver?
So that, like I said before in the previous question, hepatitis B virus infection in Indian population is the major cause of hepatocellular carcinoma in Indian population, whereas hepatitis C virus infection is the major cause of hepatocellular carcinoma in Western population. Now we have to understand that both the viruses are transmitted through blood and body fluids, and C is majorly because of blood transfusion. And all these two infection cause hepatitis, the inflammation of the liver cells, and long-term inflammation that I've told you before also. In the inflammation that leads to malignancy or cancer of the liver.
Okay, ma'am. Thank you so much. So now let us move on to understanding the role of hepatitis vaccine in curbing the spread of liver cancer. Ma'am, please explain.
So hepatitis, we are fortunate that we are having vaccine against hepatitis B virus, which is known to cause hepatocellular carcinoma in Indian subpopulation, the majority of the cases. There is a vaccine available, and it is there for all age group, and they are like, no, they have to be given booster doses depending on the levels of the protection that is there in our blood, and we have to check those level and deciding before giving the booster. So this has to be done in a monitored way, and but vaccine is available for hepatitis B, and everybody should try and take it. Now coming to hepatitis C and hepatitis B, the other protection that we can have for them is that we should be very cautious about blood transfusion, like how blood transfusion is taking place, or blood related things are being used. Use of tattoo from infected needles, which is very prevalent. Tattoo making has lately become very prevalent in our society. So we should be very careful about the sterilization procedure, or the needle, whether they are using new needle every time or not, or they are using the used needle every time, they are not changing the needle. All these things have to be taken into consideration. Then people are using drugs. So these infections are more prevalent, and the chances are more that they can get infected because they use the needles. There's common sharing of needles during those taking the drugs. Then when there is blood transfusion, like, no, if there is a requirement of blood in due to any reason by anybody, then it has to be very careful that if it has been checked, although all blood banks check it, all the blood banks are following guidelines, strict guidelines, wherein they check the presence of hepatitis B and C in the donor. But still, we should be cautious whether the blood has been checked. The needle prick injury. If you are a healthcare worker and you are giving injection to your patients, and the patient is the viral status is unknown, or the patient is hepatitis B positive or C positive, then you have to be cautious that you should not get and you should take a lot of precaution that needle prick should not happen.
Thank you so much, ma'am, for sharing all these things wherein we need to be cautious if somebody is affected with hepatitis. So, as you shared earlier, that blood transfusion needs to be carefully monitored. If somebody, is affected with hepatitis, there are chances of having blood and body fluid. Getting the virus through blood and body fluids. So these all things that you shared are related to blood in a way. What all other things that body fluid things come into that people need to be careful about apart from the ones that you shared?
So, see, even during pregnancy, when the child gets maternal blood through the placenta, so that there are certain precautions that have to be taken. When we are having sexual intercourse, during that time, people have to be very cautious. They should have protected sex. People who are known to be going to multiple people, having multiple partners, so contact with such people, sexual contact with such people should be avoided. So these are the things that we have to really take care of, and there are certain cautions and certain precautions which I said they have to be adhered to in order to prevent yourself, along with vaccination, to prevent yourself from hepatitis B and hepatitis C infection.
Thank you so much, ma'am. And ma'am, on the same topic, there are so many doubts amongst people's mind that sweat is also a part of body fluid. So does hepatitis virus spread from sweat? Does it spread from touching each other's hands or playing together in school? What are your views? What would you like to share with the audience?
No, hugging and touching each other and sweat, these things don't spread infection. They have not shown to spread infection by hugging or by touching each other. None of the literature has cited that. So I don't think so that should be an issue.
Great. Thank you so much for clearing that myth, ma'am. Let us move on to the next questions, which is what are some of the new modalities and therapies in the liver cancer treatment that are there? Please share with us and our audience.
So liver cancer treatment, as all cancer treatment, has undergone a lot of advances. So the research has really enriched us and has, changed the prognosis of liver cancer. It's not as deadly as it was in earlier days. So, but having said that, it is very clear that the earlier the cancer is detected, the better it is, because as the size of the liver lesion or the number of the liver lesion or the functioning of the liver deteriorates, or the overall general condition of the person deteriorates, the treatment becomes difficult, difficult, so to say, that not many modalities are left that we can use. And then the patient's body does not allow us to give certain modalities, because they are the body's immune mechanism is not that good that we can use it for the betterment of the patient. So it is always there that it is the earlier we approach the doctor, the treating consultant, the better. Now, coming to the modalities that are available in patients of liver cancer, there's a plethora of modalities that are available nowadays. So if we start with surgery, so surgery, we can say, like, no, liver regenerates. It's the only one of the organs of the body that regenerates. So what happens if only a part of the liver is affected, or a small lesion is there that can be dissected out? So we call it metastatectomy, or we call it the hepatitectomy. Like, that part of the liver or the lobe of the liver is dissected out, and if there's no involvement of the blood vessel, and if the lesion is small, focused in only one part of the liver, so, and the other part regrows and takes over the functioning. But for that also, the lesion should be small, confined to one area, should not be involving any blood vessel. The remaining liver should be healthy, functioning. So then in these patients, we use this. Then for surgery, the other modality that can be used is liver transplantation. Now, transplantation is getting a liver from another person, and which matches with the profile of the patient. So that is a big challenge, and the body accepting it, because it's a foreign body that is being put into the body. So if there are no rejections and the match is good, appropriate, then we can go for liver transplantation. Then there is ablation of liver cancer. So ablation means you want to kill the part of the liver that is having tumor cells. So the ablation can be due to so many, with the help of many modalities. There's radio frequency ablation, there's cryoablation, there's microwave ablation, there is ethanol ablation. So all these modalities are used in wherein the blood supply of that area is kind of stopped, and we get to kill the cell, the rapidly dividing tumor cells, due to a lack of blood supply. Then there's embolization therapy that is being practiced in liver. So that is also based on the same concept, that an emboli is put in so that the blood supply to the tumor cells are lost, that it is stopped, and then the cells who are rapidly dividing, they need lot of blood, lot of oxygen, and when it is not furnished to the cells die. So this ablation can be through TACE, through drug emboli, beads that we put in, the chemotherapy in the form of beads they are put in, or we can put in radio embolization, wherein small beads of radioactive elements are put in. So they cause the death of the tumor cells. Now, following this, then we have radiotherapy, which is available for the liver cancer. So the radiotherapy that we use is, one is external beam radiotherapy. So external beam radiotherapy per se is used in a very palliative setting, when we don't have much left in our hands, and we have to kind of decrease the pain of the patient, then we use that kind of radiation. Another form of radiotherapy that we are using is called stereotactic body radiotherapy. This is also external beam radiotherapy, but herein the size of the tumor is very less. It is like no less than 5 centimeter. So we give high dose of chemotherapy to that part of the liver, and multiple fractionated radiotherapy, and the cell, if I want to tell you, say in layman language, the cell, they die because of the radiation that is given. The cancer cells, they die. So that is the form of radiation that we can give in liver cancer. Then coming to targeted therapies we are having now, there's a lot of advancement in targeted as well as immunotherapy in liver cancer cells, liver cancer per se treatment. So now we have PD-L1 receptor blockers, we have tyrosine kinase inhibitors. So we have monoclonal antibodies, which are showing very promising results in hepatocellular carcinoma. And they are coming up, patients are coming up with longer life after being diagnosed of hepatocellular carcinoma. So these are the modalities which have really helped lately. Chemotherapy was always there, but unfortunately chemotherapy hasn't given us a very good response in liver cancer. We give chemotherapy, like long-standing, long used chemotherapy drugs like gemcitabine, chemotherapy, carboplatin. We have been using these drugs, but these drugs have not shown a very good response, and hence there was a need for newer modalities, and now immunotherapy is showing very good response. So these are the basic drugs, a broad guideline that I have given you, but we have to understand each patient is different, the treatment given is different, the treatment requirement is different, and it depends a lot on the patient's general condition, the condition of the liver, the size of the lesions that we are having, the number of lesions that we are having, and as well as the involvement of the blood vessels by those lesions.
Thank you so much for very explicitly explaining all the different treatments available out there for liver cancer, ma'am. That pretty much clears this question, and also the next question that I was about to ask, that what is the success rate that you see now of liver cancer treatments with the new advancing technologies, say for example, compared to something 15 years ago?
See, cancer is a very evolving branch. Gone are the days when cancer was taken as a death sentence. So cancer is no longer a death sentence. The research nowadays is aimed at making cancer a chronic disease. You have a cancer, okay, fine. You have a disease like BP, blood pressure, and diabetes, but it is not the end of the world. You will have the drugs which you will keep eating throughout your life, but your disease will be under control and you will live your life the normal way. So in many cancers, we have achieved, or we are on the verge of achieving that, turning cancer into a chronic disease. And a lot of research is being going on in liver cancer, and the immunotherapy drugs and the targeted drugs that we have right now in our armamentarium are helping us get longer disease-free survival and overall survival. But a lot has to be done.
Thank you so much for sharing that good news, ma'am. And some very wise golden words shared by Dr. Pragya Shukla here is to not take your cancer as your death sentence. Be hopeful and trust your doctors for the treatment that has been provided. And there have been many cases in which people have recovered of their cancers. So that is very good news to know for everybody, to not fear, cancers of any kind. Let us now move on to our next question, which is how early diagnosis can play an important role in curbing the spread of liver cancer. Ma'am, what are your views on that?
See, this holds true for all the cancers. That is why the concept of screening and early detection of cancer has come into practice. So it is very clear, and it is, very obvious that if we detect cancer at an early stage, it is the chances of getting cured are more. So, like I said previously, also the treatment also changes. There are if a single lesion is there and it is a small lesion and the rest of the liver is functioning properly, and the patient is having a good general condition, then surgery is used, and we take out that we resect out that part of the liver that has been affected by cancer. So, and but as the number of lesions increase, that is, as the number of as the the progression of the disease is there, that is late detection, the number of lesions increase, then the lesions they involve the blood vessels, then the remaining part of the liver parenchyma, the cells of liver, they start deteriorating, they are not functioning properly, then the general condition of the person is deteriorating and is not in a condition to take treatment. So all these things they come into picture the more the diagnosis is delayed. So earlier the diagnosis, the better the treatment options available, the more the treatment options available, and definitely better the outcomes.
Thank you so much for sharing that, ma'am. And of course, in your practice, you are seeing so many patients with cancer every day. So, what are some of the gaps that you notice that are still prevalent around early detection that we need to focus on, or that, in your opinion, needs to be, fixed, so that we can ensure early detection all across the country for all different types of cancers?
See, the what in our daily practice, what we see is one, the stigma attached to cancer, that cancer cannot be cured. The diagnosis of cancer is a death sentence. These things are to be done away with. Then there is the concept of screening, the availability of screening, the availability of test, the right knowledge of which tests have to be done. This is not there prevalent in the society. There are lots of lacunae about the education about of cancer, the modalities of cancer treatment, the modalities of cancer investigation, diagnosis. All these things are not that widespread. The knowledge is not that. Hence platforms like these are very important to spread. YouTube channels are very important. YouTube, because people are using YouTube a lot these days. Social media plays a lot of can play. I'm not saying does play. Itna bhi, whatever is being done is quite less to the amount that can be done on social media platforms to generate awareness about cancer and the screening modalities which are available, to make use of those modalities and to make use of the right test for early detection. So I think, and then of course cancer prevention. The prevention is definitely needs to be worked upon. People are taking tobacco in so many forms, and all forms of tobacco, and they are just not ready to understand the deleterious effect these tobacco goods have in any form on our body. Then people take in alcohol, and I don't know, from they have a myth in the society that certain amount of alcohol is good for health, or certain kind of alcohol is good for health, which is not true. Alcohol, I say this in all the programs that I do, that alcohol in any quantity and any type is bad for health. There is no quantity which is good, there is no type that is good. So then the lifestyle modifications that we need, like obesity is playing a bad role in, and it's playing a bad role in almost all the diseases that are coming into picture. Then diabetes, we have done studies in our institute, and we have published the data, and we have seen that people who are having diabetes are responding poorly to treatment. So that is a big thing. Like, no, even if you're having the same treatment, a person who is having diabetes and a person not having diabetes, they are responding in a different way. So all these things have to be, it's a package, it's a combined thing that has to be taken into consideration. And people like me should be more outgoing in telling and talking about cancer, and in dispelling myths about cancer, in allaying fright about cancer and cancer treatment. And social media platforms like you should go out of their way in spreading knowledge about cancer.
Thank you so much, ma'am. I guess your video is switched off for the last 2 seconds. Yes, we have you back. Thank you so much for sharing all the amazing views. There were some very important views that tips that you highlighted, that to not take this as a stigma and to work towards eliminating the stigma around different types of cancers. Also making sure that the people have knowledge and have availability of tests and different methods to get treatment done if they are detected with cancer. Also taking care of and about fixing their bad lifestyle habits, and also improving their lifestyle as a whole with good healthy habits. So thank you so much for taking out your time from the busy schedule. We have HOD of Clinical Oncology of Delhi State Cancer Institute here with us, Dr. Pragya Shukla. Thank you so much, ma'am. It was amazing to hear you speak on this topic to promote health awareness. I would also like to thank all our viewers for staying with us till the very end. Thank you so much. Stay happy, stay healthy. God bless.
Thank you so much.
Thank you.